Restricted entry of aid supplies results in humanitarian crisis in Gaza. ICRC, the restricted entry of aid supplies into the war-ravaged Gaza Strip, is resulting in a dire humanitarian crisis in the Palestinian enclave where food, daily necessities, and medical resources are scarce to meet the people's basic needs, according to an official of the International Committee of the Red Cross, ICRC, on Thursday. On Wednesday, the World Health Organization, WHO, delivered the first batch of medical supplies to the Gaza Strip since March 2nd of this year. Sarah Davies, public relations officer at the ICRC, Israel and the occupied territories, said the lack of food is weighing on the minds of the Gazans every day. She noted,
right now, after a very high restriction of the entry of aid to the trickle that is now entering Gaza, it is simply not enough to meet the needs of the civilians. People have nothing now. When I spoke to people in Gaza, they told me, we don't have food. One of our drivers said to me that if you have bread, it is a good day. If you have a piece of pita bread and your family has bread, it's a good day. When you don't have that bread, you spend most of your day wondering what it is you're going to be able to eat. What are you going to be able to find to feed your family, to feed your children?
She said that besides food, shortage of other basics like clothes and medicines is also haunting the local people. Said Davies,
the daily volumes and categories of humanitarian aid currently entering Gaza is difficult to define, but what we know for certain is that it is not enough. It is not enough to meet the basic needs of civilians in Gaza. It is not enough medical supplies, it's not enough medical equipment, it is not enough hygiene items, baby formula, diapers, not enough food, not enough clothes, not enough medications, not enough household items, things like pots and pans or oil. For people, it's simply not enough to meet the demands.
Palestinians have been killed today.
She said the chaos in Gaza are also undermining the medical system in the region.
The healthcare system across Gaza has been severely impacted due to the hostilities, due to displacement of people, due to medical staff and personnel being killed or injured, due to evacuation orders, due to lack of supplies and equipment and materials that are vital to the running of medical facilities and hospitals.
She said, in a related development, Israel and Iran reached a ceasefire on June 24 after 12 days of military conflict between the two countries. ICRC, Near and Middle East regional spokeswoman Suhair Zakut, said political and diplomatic efforts are the sole solution to such conflicts amid the turbulent situation around the world. She said,
today more than ever, the IHL, the respect of international humanitarian law, is needed to alleviate the suffering, and this also needed from the international community to strengthen the respect of the humanitarian law. But also what we need, and we also witness that decisive political and diplomatic efforts and meaningful action by political leaders can bring stability, can end the suffering, and can change the lives of millions across the region.